I guess before I start, I'm going to do a bit of an update on where we're at, but I'd just really like to add, although you've had lots of welcomes, my welcome to you as well, and acknowledge the significant commitment you've all made to take the 2 days out of your very busy jobs back in your home hospitals. And just reflect that this work resonates with your own personal values that mean you've allocated time to this really important work. And so we really appreciate that, and we understand the commitment you make to come here. We've got 2 days to work together, and which I hope will present the real opportunity to connect or reconnect with colleagues from other regions. Share your work in this national effort, one that is world leading, and we'll come to that again. So welcome. Hope you're all challenged and enjoy the learning and sharing journey ahead. So my job now is to provide a brief update about how we, as the collaborative, are progressing and reflect on the objectives of the learning session. Remembering this is the last time together formally that we will, but hopefully the network is strong and gets stronger during today, so we'll be able to do that. After I've done a brief update, Prem's going to come and talk about the national picture. So first of all, if I can make this work, let's revisit a familiar slide. I'm sure everyone has seen this by now, about the collaborative methodology. And just look at where we are on the journey. So this reminds us how far we've come on this journey. It was just this time last year that we'd completed the regional learning session zeros. Since then, we've met at 2 national learning events in Wellington and Christchurch. Each of those sessions was a great success because of your input and a valuable opportunity to network, learn and share. Between the learning sessions, of course, have been the crucial action periods, which are the engine room of any collaborative. Change ideas have been developed and tested. There have been many challenges along the way, but we have achieved plenty. While the national meetings are essential, an important element of the collaborative has been the one-on-one contact between the national teams and the teams at the coalface, especially the site visits. The national team has really appreciated everyone's efforts to set aside valuable time to deep dive into the work, in particular about the data relating to measures and testing using PDSA. Many of you have been with the collaborative since its beginning. Thank you for your tenacity and your hard work. Some teams have struggled to identify harm in their organisations. Thank you for your perseverance and commitment. We've also had teams join the collaborative just recently. A warm welcome to you. We look forward to your contribution and hope you'll enjoy the next 2 days and an opportunity to look to where you can leapfrog from. So what have we achieved to date? It's opportune to reflect on the key goals of the collaboratives. Are we on track to achieve what we set out to? The main outcome of the collaborative is a reduction in opioid-related harm. Some teams have measured improvement in important outcome measures, rate of constipation, as Chris was talking about, while some have noted changes in their process measures, frequency and accuracy of documentation. We have some teams who feel confident they have tested interventions that might go into the eventual bundle of care. This is absolutely fantastic. We need to work together to continue to ensure these interventions are supported by data and evidence. As in keeping with all that we do, we need to have a robust evidence to support the creation of the bundle of care. The big question, and the question we are often asked by our board, is, will we have a bundle? From the work and the results that we are seeing across the country, the national team feel fairly confident that we will have a New Zealand developed bundle of care for the safe use of opioids. The component parts of the bundle will be discussed through the next 2 days, and we need to consolidate this by March. The world is watching you. I was recently at a conference where Maureen Bisgano from IHI was there and Frank Federico, and both talked to me about we're watching you. It's exciting work and it's world leading. The next phase, once the bundle is created, is for us to think about sustainable spread and scale up. But for now, let us not take our eyes off the ball. We want to thank you again, your respective organisations, for the efforts. Encourage you to continue the PDSA cycles, measurement and data, vital to providing the rigorous evidence to inform the bundle of care. What else have we achieved? Well, these are some of our other goals and our achievements. An important element of the collaborative has been about building capability and quality improvement across the DHB teams. We've definitely seen some exciting changes so far, and it's been great to hear of teams and individuals using the model for improvement elsewhere in their organisations that they learned while they were working around the collaborative. Synergia, the collaborative's evaluators, will share some interesting findings with you tomorrow. But one that stands out for me is that we have also seen an increase in participants' experience of formal collaboratives, knowledge of quality improvement methods and their experience in applying them, and experience using the Plan, Do, Study, Act tool as part of the action learning. This is great. Thank you for embracing the learnings that we've been able to share with you. Tomorrow we'll have a session on how we might create an enduring network once we transition from the collaborative to spread and implementation. You've come together as a collective in an incredible fashion. Look at the attendance here today. Let's ensure we maximise the opportunity offered from having such a connected and motivated group of people to make sure that the networks are enduring beyond the life of the formal collaborative period. This flows well into the third bullet point about profiling high-risk medicines, which will continue as a key work stream in the Enduring Medication Safety Program led by the Commission. At the last learning session, 3/4 of you reported that being part of the collaborative had raised the profile of high-risk medicines in general in your organisations. Thank you for that work. It's great to see key messages about high-risk medicines being supported by the collaborative and the leveraging of these collaboratives for that information. Our collective challenge is to make sure that this work becomes embedded into the medication safety programs back in your local and regular contexts. So to the next 2 days. The objectives of the learning session are in the program and very clear. Also, I think it's useful to highlight a few areas that the national team are interested in hearing your views about during today and tomorrow. We assume there will be a bundle. So, what does implementation and spread of the bundle look like to you? Options about this very important facet of the work program have been explored by the national team, but any decisions must have your input. How do we work together to gain the maximum benefit of the collaborative's outputs for both the bundle and other deliverables? How can we hold the gains? Having achieved so much, how should we support sustainability? Once again, networking, staying connected, team to commission, across the breadth of the sector. We look forward to hearing your views and each team sharing the collaborative work over the next 2 days. Please enjoy the learning session. Thank you.